First of all, where are you today? I don't know if you saw the pictures from nightclubs last night. Infection rates are rising, hospitalisations up, not as much, but a bit as well. I mean, more people are going to catch this deadly disease. Are you concerned at all that we're looking at infection rates that we've not seen at all in the last 18 months?
A bit. And I think that, as you said, some people are euphoric, some people are overcautious. I think the correct position is somewhere in between the two of them. The government are removing the legal restrictions on us. That does not mean that we have no personal responsibility to exercise. And I think that's the key thing. It's look at the situation in which you find yourself. What is the risk of potentially transmitting that to someone else or catching it from someone else? And be sensible. If you're in a crowded space, yes, I would wear a mask for the moment, given the rate of rise of infections. But I wouldn't be too worried, given the clear difference that the vaccine has made between the number of infections and the number of hospitalizations and the number of deaths we're seeing. The last time we saw this level, for example, of number of cases, we were seeing about 1,600 deaths a day. At the moment, we're seeing about 20 to 40, something in that range. So clearly the vaccine's made a very big difference. Also, if you look at the excess death rate in the country, you'll see that in June, we had about 10,000 fewer people than we would normally expect to see die at that time of year, and the same in May. So clearly we're in a very different situation from we were before. I'm not sure, however, packing into no distancing and no masks is a sensible thing to do.
So just on that, are you saying that the government shouldn't have allowed the reopening of nightclubs then? Like in Scotland?
No, I think when people go, they need to take responsibility. It can't be just about what the government does. The country's got to move back to a position where people exercise their own personal responsibility for their safety and the safety of others. And I think that's just what we need to be getting people used to. We've sort of got used to this very binary position of if the government tells you to do something, that's what you do. And you don't have to make any decision for yourself. We need to change that. The whole of our society is based on the principle of personal responsibility, but it also has to come along, Darren, with data. And I think that we need to get more information. For example, not just the number of people going into hospital, but who is going into hospital, what age groups, have they been vaccinated at all? Have they had one? Have they had two? Did they mix before they gave the appropriate time after their vaccine? Have they pre-existing conditions? How long are they in hospital for? These things, I think, are all necessary. If the government is going to not make those decisions and we have to make them on our behalf, surely we should be getting the same sort of information that the government has when it made those decisions for us. So I think that there's a balance, a new equilibrium to be found here.
Dr. Fox, as you said, and we asked the vaccine minister what he'll be doing. Will he be wearing a mask? He said he will continue wearing a mask at times. What will you be doing? Do you mind me asking how you're going, what your stance is going forward?
I don't mind at all. I think it's dependent on the situation. I think if I'm on a bus or the tube, of course I'll wear a mask. If I'm on an aeroplane, I'll wear a mask, again, in an enclosed space for the moment. If I'm in a supermarket that's crowded, I'll probably wear a mask. If I'm in a supermarket that's empty, I probably won't. We have to make sensible decisions, and you can't have hard and fast rules. That's why we should be driven by data. We should be driven by the situation in which we find ourselves and make our own personal decisions. It's the only way to get a responsible society. In the end, we're going to have to learn to live with COVID. It's going to be with us permanently. So how are we going to find a way in which we can exercise our normal lives and have our normal family and friends in contact and do our work properly, safely, but at the same time recognizing that there will still be a risk. That risk may not be any greater in the future than, say, a major flu outbreak. And we just need to be careful. We also have to be, I think the media also have a role not to overdo things like case numbers, but always put them in context of the rate of hospitalizations and encourage people to continue to get the vaccine. One of the weaknesses that there still is the gaps that we have in some groups, particularly some young people who are simply not being immunized. That, of course, not only puts them at risk, but puts other people at risk. So the more people become immunized, the more we exercise our personal responsibility, the safer we all are.
Folks, one thing we do know is there are, as we know, a lot of people self-isolating at the moment because they've been pinged. They're calling it the pingdemic. As we come out of lockdown and this so-called freedom and personal responsibility, it is a concern, though, that there may be staff shortages, huge amounts of staff shortages of those having to isolate and those that can't service a community that wants to get back out there and back on its feet.
Yes, and I've seen that in my own constituency where yesterday I went for a lovely pub lunch in the Ring of Bells in Nailsea, and there were some items not available because of a lack of transport to make the deliveries. It's been across all different sectors. And I think that the government should look again at those self-isolating rules, because it doesn't make any sense to have the same rules on self-isolation if you've been exposed to a case when you have had 2 jabs rather than in the period when we had none at all. So I think, again, we need to take a sensible look at risk in all of that as we go forward, because if we want people to comply with their exercise of personal responsibility, it has to be seen to be reasonable and based on proper data.
And just very, very finally, Dr. Fox, we know the Prime Minister somewhat U-turned on this yesterday, didn't he, about him having to isolate. I mean, from me looking at it, there's lots of people criticising the government, saying, it's one rule for them, one rule for others. But he is the Prime Minister, and should we expect that the rules that everyone else has to adhere to the man that's meant to be running the country? I mean, it's frankly ridiculous that someone who's been double jabbed, who's had the virus before, is having to self-isolate when he should be getting on with his job, no?
Well, of course he needs to be getting on with his job. The question, of course, is always reality and perception. And if you're still asking people to follow the rules, it doesn't look good if those in charge are not following the rules. We don't live, I'm afraid, in an era of very great balance at the present time, where people will say, well, of course, the Prime Minister has to be getting on with his job. He has to be meeting people, has to be doing things. It's all about the politics of perception. And the politics of perception in this case is one.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.